I've had a really long and interesting career. I have seen huge changes. If you think, when I went to medical school, there were no CT scanners, there were no MRI images, there were no ultrasound machines. So we already have the beginnings of that revolution in our ability to image the patient. When I was a resident in radiation oncology, we were still in New Zealand using cobalt machines. We were still doing our treatment planning pretty much with paper and a slide rule. And so if you allow me to start from that position, as I look at my career, we have seen tremendous change. We've learned to adapt, we've learned to modify, and we're now learning again how to use the technologies that we have to the best advantage. There's one story, I don't think it's apocryphal, that EMI produced the first first CT scanner. And their marketing people went out and did a whole pile of surveys, and they came up with the view that there would be a world market for CT scanners of 6 units a year. We're now beginning to understand the difference also between the image as, if you like, a picture, and the image as a biomarker. And so I think that we're on the forefront of an amazing change in our ability now to use those technologies. I think with the introduction of the PET CT scanner, and more importantly the PET MRI scanner, we're going to begin to use the image as a biomarker. So can we stratify patients for treatment? Can we predict treatment response? Can we actually use the image in a much more sophisticated way in treatment planning to ensure that our gross tumor volume is accurate? I think Gino Falone and his LINAC MR is going to give us the ability to track changes in the real functional volume of the tumor to ensure that that component of what we are doing. I think it's interesting that we're now seeing increasing papers in the literature looking at ultrasound as a therapeutic technology as well as a diagnostic technology. So the changes have been night and day. I think we're now beginning to learn that we've got a lot to learn about how to use the technologies we've developed. But at the end of the day, the patient has benefited, whether we're using it as a diagnostic tool, as a predictive tool, or as a treatment planning tool. There's no doubt that the care now is far better than it was 200 years ago when I was training.